Hey everyone, Dr. Asad Saleem here. Today, we're diving deep into pancreatitis. It's a condition that can be quite serious, and as healthcare professionals, it's crucial we understand it thoroughly. First up, let's talk about what pancreatitis actually is. Simply put, it's inflammation of the pancreas, a gland located behind your stomach that plays a key role in digestion and blood sugar regulation. There are two main types, acute and chronic. Acute pancreatitis comes on suddenly, whereas chronic pancreatitis is a long-standing inflammation that often leads to permanent damage. Now, onto the causes. The most common causes of acute pancreatitis are gallstones and chronic heavy alcohol use. Other causes include medications, infections, trauma, and certain genetic conditions. For chronic pancreatitis, chronic alcohol use is again a major factor, but it can also be due to autoimmune problems or cystic fibrosis. Next, let's discuss the clinical features. Patients with acute pancreatitis typically present with sudden onset of severe abdominal pain that radiates to the back, nausea, vomiting, and sometimes fever. In chronic cases, the pain might be less intense but more persistent, and patients might experience weight loss or steatorrhea due to malabsorption. To diagnose pancreatitis, we rely on a combination of laboratory tests and imaging studies. Blood tests will show elevated levels of pancreatic enzymes like amylase and lipase. Imaging such as an abdominal ultrasound or CT scan can help us see any inflammation or complications like pseudocysts or abscesses. MRCP or magnetic resonance cholangiopancreatography can be particularly useful in visualizing the pancreatic ducts. Treatment varies depending on the severity and type of pancreatitis. For acute pancreatitis, initial treatment focuses on supportive care, IV fluids, pain relief, and fasting to rest the pancreas. In severe cases, patients might need more intensive interventions like antibiotics for infections or surgery to remove gallstones. Chronic pancreatitis treatment aims to manage pain, replace pancreatic enzymes, and address complications. Lifestyle modifications, especially abstaining from alcohol and smoking, are crucial. Speaking of lifestyle, let's touch on dietary plans. For patients recovering from acute pancreatitis, a low-fat diet is usually recommended initially. Small, frequent meals can be easier on the digestive system. In chronic pancreatitis, the focus is on ensuring adequate nutrition despite malabsorption issues. Patients may need pancreatic enzyme supplements and should avoid foods that trigger symptoms. Alright, that's a wrap on today's discussion about pancreatitis. If you found this video helpful, make sure to like, comment, and share it with your colleagues. Don't forget to subscribe to my channel at Asad Saleem 1414 for more medical insights. Let's keep learning and improving patient care together. Thanks for watching. #pancreatitis, #healthcare professionals, #medical insights, #Asad Saleem, #medical education, #Dr. Life.